So let's talk a little bit about what the treatments for insomnia are. Like I discussed earlier, it's basically behavioral interventions are considered first line for most patients. Now certainly you do want to make sure that when you've made your diagnosis that there's no other underlying medical issue that's being associated with a patient's insomnia. So we talk first line is sleep hygiene. So what sleep hygiene involves is a lot of behavioral things that you can do to help reset your biological clock in order to sleep more healthy and soundly at nighttime. First off, we usually start with maintaining a regular sleep-wake cycle. So what that means is trying to go to bed at the same time every night and waking up at the same time in the morning. The other thing is to make sure that you have a comfortable, dark, quiet environment that's free from distractions in order to fall asleep. Unfortunately, electronic devices, the computer, the TV, they're actually stimulating, and so they're recommended to avoid at least an hour or two prior to falling asleep. Many people also improve their sleep health by creating a routine. A lot of times people will sit down, read a little bit in a different room. We recommend using your bed only for sleep or sickness. Try to keep work away from your bedroom. The other things that you can do to help improve sleep are finish eating about 2 to 3 hours before you go to bed. Other things, alcohol, tobacco, they usually recommend that you discontinue these things 2 to 4 hours prior to going to sleep. As many people know, you're supposed to avoid naps. If you do have to take a nap, try and limit it to 20 minutes only. Another pearl to help you get better sleep is make sure that you try and go to bed only when you're sleepy. If you're laying there and it's been 15 or 20 minutes, we actually recommend that you get up, leave the room, go out and do something, listen to some soothing music or read, and then come back to bed when you're feeling sleepy. Lastly, it's really important to make sure that you decompress, address any things that are stressing you out or that are on your mind prior to trying to go to sleep. We recommend trying to do these earlier in the day. So in general, if at all possible, during the daylight hours, it's important to actually try and get a little bit of sunshine. This keeps the melatonin in your body regular, helps keep you on a good sleep-wake cycle. We recommend staying well hydrated during the day and exercising during the daytime. If you have to exercise later on in the night, make sure it's at least 2 to 4 hours prior to wanting to fall asleep. The other things that we do use, again, like I mentioned, behavioral modifications are first line when it comes to insomnia. We actually do have specific cognitive behavioral therapists that will help treat insomnia. What that means is we're using mental exercises, which is basically cognition, as well as lifestyle interventions to help you sleep more soundly at bedtime. These things can involve a lot of techniques that help you relax your mind and your body. More specifically, things like meditation, guided imagery, biofeedback have all been shown to be very successful. And in this electronic day and age, there's actually online cognitive behavioral therapists, and there's actually some apps that we do use in the clinical setting that help people relax so that they're able to fall asleep better. Ultimately, if we do need to, we do have medications that help people, but again, lifestyle modifications are preferred in most cases. Additionally, too, with the cognitive behavioral therapy, many times you're able to address any underlying issues that are causing someone to not be able to sleep. Within the medicine categories, we basically have several different categories that we use. First and foremost, people usually do try over-the-counter melatonin. It is preferred to try the extended release. Many people recommend sublingual as the delivery system gets into your body faster. There are prescription medications that work with similar body chemistry. They increase the amount of melatonin in your body. The second category, which is probably more commonly used, are medications called GABA agonists. Your GABA system is basically your body's inhibitory nervous system. So what happens is if we enhance the effects of GABA, we will induce you to feel very tired. So we do use medications like the benzodiazepines. Unfortunately, there is risks and benefits, so they are not necessarily preferred. There is another class of medication called the non-benzodiazepine hypnotic medicines. After that, we sometimes will use medications that will often treat more than one thing. We often will use medications that are traditionally used perhaps for anxiety or depression to, again, induce you to feel more tired, address maybe some underlying issues so you can sleep better. There's some newer medicines out there which are called the orexin agonists, and basically most medicines that we've had to date work on enhancing the sleep cycle, i.e. making you more tired. Newer technologies are working at inhibiting your awake cycle. Finally, a couple other classes of medicines that are used sort of off-label but can be helpful depending on the patient are medications that we often use for epilepsy, if you can think of epilepsy or seizures as having increased activity in the brain. We use these medications to kind of calm the brain down and thus induce sleep. Additionally, if people have an underlying psychiatric issue, we have medications that can target those as well.